It's a Medicare Monday presented by Strive Medicare. I'm Tori Kale-Schultz here, and I am with Rick Teska. He is the CEO. Rick, let's talk about Medicare Advantage Plans. What are those?
So Medicare Advantage Plans are sold by private companies and they replace your original Medicare Parts A and B. When you buy a Medicare Advantage Plan, the insurance company, not Medicare, provides all your health care coverage and sometimes includes prescription drug coverage. And with these plans, you usually have to use doctors in the network, and they come with deductibles and copayments on most services that you receive. With these plans, they're renewable annually, meaning you can change your plan in many different ways. This makes it very important to review your annual notice of change that you get each year.
What about Medicare Supplements?
Sure. Medicare Supplement plans are sold by private companies. They complement your original Medicare and also sometimes called Medigap policies. These plans cover most, if not all, of your out-of-pocket costs under Parts A and B. Every Medigap policy must follow laws designed to protect you. Insurance companies can only offer standardized Medigap policy, which means the coverage is the same with all carriers. So whether you're new to Medicare or already on Medicare, we have free helpful comparison tools for those new to Medicare. My best-selling book, The Medicare Breakdown, the alphabet soup of Medicare, walks you through all parts of Medicare. And it explains your choice between Medicare Supplements, Medicare Advantage, and Part D prescription drug plans. If you're already on Medicare and looking to compare your plans during this annual enrollment period, our Medicare Annual Enrollment Workbook is a great tool to help with this. You can visit our website at strivemedicare.com or stop by our local office to request these.
A lot of information there, folks. The best thing you could do is stop in and see Rick and his team. They are going to help you out. This has been a Medicare Monday.